Hep C has definitely increased in the past couple of years. Unfortunately, it's overarchingly increased about 50%, and in multiple states it's greater than 200%. And you know, there used to be sort of one large hump, you know, for people born between 1945 and 65, and then a smattering of other people. And now we essentially have a bimodal incident rate and prevalence data where there's a young cohort and an older cohort. And so this younger cohort, unfortunately, is increasing the amount of Hep C that we're seeing. And we're really going to have to make some pretty quick policy changes, I think, if we're going to get these people treated before they start to have poor outcomes. So certainly there is, I mean, Mavorite was just approved 2 weeks ago, or a couple weeks ago, and will be a potentially very beneficial drug treatment because it's 8 weeks of therapy. So when we're talking about, I mean, it's interesting because there's a double-edged sword. When we're talking about treating people who might have more chaotic lives, the fact that this new drug is only 8 weeks of treatment could be very beneficial, because then keeping them engaged in care is only within 8 weeks. The double-edged sword is, you know, the more simple that we make Hep C treatment, then the less opportunity we have to engage people in other aspects of their medical care, like drug treatment or their HIV care or mental health issues. So I think that Mavorite is 8 weeks is going to be really beneficial in terms of the fact that it's pan-genotypic, can be used in renal disease, is 8 weeks. I mean, that provides an amazing opportunity to go into resource poor areas. And when I say that, I don't just mean you know, developing countries. I mean resource poor places in Appalachia, in the Bronx, etc., where if you could go in and do rapid testing that said, hey, not just antibody testing, but we do rapid testing, we know your viral load is positive, then essentially we'd have to do very little blood work to start them on Hep C treatment. And this could be one of the most beneficial ways to have a true public health benefit. So I see that as a potentially great advantage in the near future, as long as we keep people then engaged in other parts of their health care.